Lorna and I want to welcome you all here in this session. We're going to be speaking about problems of ex-members and of families and interventions with families. We want to begin by noting that today is Bastille Day, so anyone here from France, vive la France. We also note that we've got two people filming us, and we know that being a film star makes you an instant expert on many matters, such as postpartum depression and medication and the like. So we're very glad that we're now film stars. Lorna is going to speak about working with former cult members, and I will speak about working with families.
For almost 30 years, Bill and I have had the privilege of facilitating a support group for former cultists. Through this group and through our work as therapists, we've had the opportunity to learn a wide range of post-cult difficulties. We've also heard from former members about effective coping strategies that are used to deal with post-cult problems. Today I plan to discuss some of what I've learned. Can everyone hear me? The individuals began seeing in the 1970s, the individuals we began seeing in the 1970s generally came from our support group within 2 to 3 months of having left their cult. They often had gone through an exit counseling process, which enabled them to get a good understanding of the deceptive and exploitive environment of the cult. However, although they did not have a desire to return, they continued to reveal how they continued to reveal how the cult impacted on them through their attitudes and personality characteristics. For example, those who were from Eastern religious cults that focused on subservience to a spiritual leader kept their heads bowed, spoke with a sing-song manner, and continued to struggle with their desire to be good and holy, while those who were in cults that emphasized sexuality as a lure for recruitment continued to relate to others in a seductive manner. These former cult members seemed to struggle with an attempt to integrate their cultic identity with their former selves. They initially described experiencing a sense of confusion manifest in their continued automatic expression of the cult's attitudes and beliefs, alongside attitudes held by their pre-cult selves. They appeared to be having difficulty integrating the bizarre cultic world from which they had exited with the outside world, the world which they had spent their youth and adolescence. In some ways, they appeared to be strangers to their own families and their former selves. They showed symptoms that revealed their sense of depletion, disorientation, alienation, and identity confusion. Singer and Afshi, in their article Thought Reform Programs and the Reduction of Psychiatric Casualties, written in the Psychiatric Annals of 1990, noted that these individuals felt like immigrants entering a new culture, bringing with them beliefs from their culture life that conflicted with the norms of the larger society. West defined the new cult personality as the pseudo-personality. Several authors, including West and Martin and Singer, described how in response to a step-by-step process whereby the cult leader gains increased control, the new cultic personality will be superimposed upon the original personality, which, while not forgotten, will be enveloped within the shell of the new personality. This new cultic identification can be seen as a highly regressive one, since it is part of the general regression that occurs in recruits to cults. It also can be seen as cult-induced psychopathology. Let me give you an example of a young woman who I saw for therapy during this period. In the early 1980s, I met with Janine, who had left an Eastern meditation group 1 month prior to entering therapy. She had returned home suddenly after a heated dispute with one of the leaders. Her parents arranged for her to see me after she had gone through voluntary exit counseling with former members of her group. After 8 years of doing service, she had become disillusioned with some of the deceptive practices of the leadership. Women were exploited in this cult, and as an unmarried woman, her position was generally to be in service to the married couples. She was functioning as a babysitter and a cleaning woman. I pointed out that in contrast to the elitist and idealistic doctrine that was promised her in the beginning, her life had become rather limited. In her first therapy session with me, Janine expressed a concern about whether I would be spiritual enough to work with her. I responded that I wasn't sure if I was spiritual enough because I wasn't sure what she really meant by the term. Thus began a long process of attempting to define and thereby demystify Janine's cult jargon and ideology. Initially, when she spoke with me, she often used amorphous language, speaking in such an abstract manner that it was difficult for me to follow her. The difficulty I was experiencing in understanding and concentrating on what she was saying helped me understand and become aware of the diffuse and trance-inducing environment of her cult. Directly sharing my experience of her with Janine helped her objectify her cult experience. The goal here was to help her become more aware of how she was remaining disconnected to those around her, and to ground this young woman who seemed to float on air with language and demeanor. At the same time, Janine began to notice that continued use of cult jargon seemed to have an alienating effect on others in her post-cult life. This gave her a strong incentive to lessen its use. However, making the switch from cult jargon to language that is commonly used in the outside world was difficult for Janine after 8 years in her group. Those who've been in cultic groups for decades or have been raised in them might feel that they are learning a new language when they enter the outside world. Janine continued to bring aspects of her cult with her into her post-cult life. That is, she continued to dress in hippie style, to practice some yoga meditation, and to maintain a vegetarian diet. Some of these features were not challenged by me. In our sessions, however, we explored how the continued practice of meditation affected her, looking at whether it was a regressive experience, returning her to cultic thinking, or a progressive experience, providing her with more structure and a sense of well-being in her current life. After her departure, Janine described finding herself dissociating, automatically drifting into a trance. She felt that she could lose periods of time and was becoming unproductive. She would find herself mesmerized in front of the television for long periods of time. In having her describe her experience of trance, it became clear that Janine was referring to dissociation, depersonalization, and derealization. According to Lin and Rue in their book Dissociation, Dissociation has come to represent different types of phenomena and constructs, from altered experiences of detachment from the self or the surroundings, to a lack of integration between various mental processes, to a defense mechanism which functions to ward off anxiety or pain. According to Moore and Fine, in psychoanalytic terms and concepts, in depersonalizations, one's perception of oneself splits in two. There is a detached, observing self and a participating, experiencing self. This results in a feeling of self-estrangement. Derealization is an experience involving a feeling that the external world is unreal and strange, no longer like it used to be. One's surroundings may appear flat, two-dimensional, colorless, drab, and without emotional significance. Usually, derealization occurs in association with depersonalization. Both can be used to ward off anxiety. Depersonalization involves withdrawal of the cathexis from the self, while in derealization, the cathexis is drawn from objects, resulting in the feeling of estrangement of the world. All of us have periods of dissociation. However, certain practices, meditation, speaking in tongues, chanting, decreeing, guided inventory, breathing techniques, etc., appear to have induced former members to involuntarily enter altered states of consciousness more regularly or automatically than they would otherwise do. Even after leaving the group, this response might occur under stress. When it happens, it can impair one's concentration, attention, memory, and coping skills. Once Janine began to link increased dissociation to her practice of meditation, she gave up her practice on her own. In this way, my client was similar to many individuals who leave cults who continue practices such as this. Because Janine also found herself going into trance during unstructured periods, or when experiencing stress, we focused on how she could provide more structure to her life and how she could recognize trigger situations. Although Janine attended college prior to her cult involvement, she initially was reluctant to return to school since she was experiencing cognitive difficulties. Although she had been a voracious reader prior to the cult, it was difficult for her to concentrate while reading or when people gave her complex directions. She feared she had lost some of her intelligence. She worked to increase her reading periods, began reading the newspaper daily, made lists to help her establish a regular routine, and she avoided long periods in front of the television. In time, her cognitive abilities increased to her pre-cult level, and Janine was able to begin taking college courses again. However, this continued to be fraught with anxiety because Janine had been influenced to feel that she was nothing without her cult leader. Looking at how this was suggested to her in the cult and looking at her pre-cult accomplishments helped her quite a bit. Janine also felt that she had become an oddball. Not only did she speak and dress differently from others, but she feared that she often missed social cues and that she appeared more childish than her contemporaries. She was unsure of how to act with men after having cult-prescribed relationships that had increased her subservient manner, and she would appear strange in her relationships with men in the outside world. cult. She was very concerned about this. And many years after celibacy, sexual manipulation, or abuse in the cult, relationships can create anxieties for former cultists. Janine also had become very passive, looking to others to guide her with decision-making. All aspects of her personal life, such as diet, dress, and marital choice, had become more and more controlled by the cult leader. It was difficult for her to initiate in her life after the cult. Also, doubts about the leader's beliefs and independent thinking had been discouraged in the cult. Additionally, she believed she had made a terrible mistake by joining her group, and she feared making other mistakes in the future. Because of her uncertainty, she also feared being controlled by others, including her family and me, her therapist. We focused on these concerns. She was able to begin to figure out how to overcome them. In contrast to the ex-members seen years ago, the majority of ex-cultists seen in recent years usually do not present themselves as dramatically different from the outside world. Their appearance might not be as otherworldly as those who left 25 years ago. The majority of cults today seem to be not as isolated. While 20 or 30 years ago there were more cults with an Eastern religious doctrine, today it appears there might be more Bible-based or psychotherapy-type cults. Therefore, on the surface at least, members do not appear to be as otherworldly as their earlier counterparts. Also, those who seek help today are more likely to have left a cult on their own, in contrast to having left on as a result of a deprogramming or exit counseling. And we might not see them until several months or even years after their departure. Therefore, the residual identifications with the cult and the cult leader might have loosened a bit, and there might be increased integration of their pre-cult and post-cult personalities. However, some cultic identifications, that is, identifications with the leader's doctrine and suggestions, do remain. For example, some former cult members describe having more critical attitudes towards themselves and others after leaving. Some have incorporated the harsh attitudes of their cult leader. Many individuals continue to feel shame, believing that the cult doctrine was perfect and somehow they are flawed because they could not apply it successfully. Cult leaders often are continued to be held in high esteem. There often is the fear that if they totally give up their belief system, they will be damned to some version of hell. They feel anxious, believing that they are no longer protected by the magical powers of the cult leader. Others can be ashamed of their cult-induced sexuality, aggressive, or antisocial behavior. While in the cult, these behaviors were reinterpreted as actions for the greater good. Without the leader's rationalizations, former members often feel remorseful and ashamed. They fear telling anyone about this. Former cultists can become involved in self-destructive behavior, such as excessive drinking, taking drugs, shoplifting, promiscuous sex, etc. Not only because this has been suggested to them by the leader, but also because they are filled with self-hatred that has been implanted during their years in the cult. And there is an impulse to externalize an inner feeling of both anger and badness. Angry feelings were projected away from the cult leader in the cult and onto the outside world. And then when they leave the cult, they become part of that outside world. So they become the terrible person they were told people in the outside world are. So they also rebel against the restrictions that have been replaced upon them in the cult. So this is another reason for increased going wild, after the cult, as some people do. There can also be a need to make up for lost time and a difficulty in knowing what they truly desire after years of being told what they desire. Some of this behavior seems to be reflective of a feeling that they have presently little control over their lives, and they can only feel independent by rebelling against all the cult stood for. It's not uncommon for former cultists to think of the cult leader during sex or constantly feel enraged by a cult leader who takes up too much of their energy or thought life. They might feel anxious all the time. Without an understanding of their cult experience, those who leave on their own tend to be plagued by after effects longer than those who gain such an understanding. This is particularly true for individuals who've spent long periods of time in a cult. Because of shame, guilt, and magical thinking induced by the cult, they often continue to live narrow lives, unable to fulfill their potential in work, and unable to play and feel simple pleasure in life. Former cultists need to know their reactions are related to cultic suggestion, practices, manipulations, and exploitations by others. For example, somatic complaints might be related to the cult suggestion that a person's body will rot, or that a person will contract a severe illness if he leaves the group. Fear of accidents, death, or negative life circumstances might also have to do with cultic suggestion, and a general fearfulness of disaster now that the cult's supposed protection no longer exists in the former member's life. In the cult, emotions are manipulated by others. When cultists leave the group, they continue to feel unable to control or feel their emotions. That is, while some former members will appear to be lacking in affect, others will easily feel overwhelmed. We've noticed this particularly in those who are from mass therapy groups, where members are subjected to highly confrontational techniques that violated their protective defenses against affect. In these cults, boundaries and individual defense mechanisms are invaded, and some members appear to be flooded with their emotions. This often leaves them in a manic state. Others, particularly those from Bible-based group, appear to suffer from symptoms related to depression. They describe feeling that they are no longer good people and fear they are on the path to hell. They have a need to punish themselves and sometimes feel suicidal. Those who experience repeated verbal, physical, or sexual abuse often develop a cluster of symptoms classified as post-traumatic stress syndrome, including flashbacks, nightmares, guilt, self-loathing, and social withdrawal. Most former cultists suffer from a strong sense of loneliness. They were constantly surrounded by others in the cult and induced to identify with the leader. Cult members became aware of the positive effect of belonging to a single-minded community. However, the pressure for unanimity is also a regressive influence, precluding any type of critical assessment of this coercive and highly suggestive experience. Recruits are actively discouraged from differentiating their own thoughts and feelings from the group. By punishing any expression of doubt and rewarding compliance, the cult leader induces members to become more and more dependent on receiving his approval through, or his or her approval through obedient behavior. In this way, ego functions that interfere with group functions are attacked and diminished. Coupled with loneliness are feelings of sadness and grief, sensing a loss of a life that promised total fulfillment. Former cultists often are mourning the loss of a period in their lives that appeared to fill their idealism. Sadness is a healthy reaction to loss. It often is helpful for former cult members to see how their youthful idealism was exploited by the cult. For some, sadness is linked with missed opportunities to enter a satisfying relationship, have a family, or acquire career skills. However, many former members do eventually return to school, find enriching employment, or enter into satisfying relationships. But it can take time to gain the confidence and skill to do so, and particularly those who spent 20 or 30 years in their groups. They tend to feel far behind their contemporaries in the outside world. Getting in touch with the ongoing exploitation of the cult often leads to anger. After a time, there is an expression of anger at the cult leader and or a desire to act against the group for some. Social or legal action at times can be seen as a progressive step. Rather than directing anger against the self, the former cultist is now taking constructive actions against the manipulators or through education, which is preventing others from getting ensnared. However, sometimes too much energy remains invested in the cult. This energy can keep the former cultist from progressing in his or her post-cult life. For some, the intensity of this anger is the continuation of how the cult had them split off and project anger to the outside world. Now they are doing the exact opposite thing, splitting off and projecting all their anger onto the cult. Since the early 1990s, we have noticed and worked with an increasing number of individuals who have left cults after 2 or 3 decades of membership. Many of these individuals are married with children. Married former cultists have to deal with the typical post-cult difficulties previously described. However, former cultists who are married also have to deal with their marital and parent-child relationships, and consequently with their cult-influenced reactions to their spouses and children. Their children had the formidable task of having to deal with neglect and or abuse stemming from their cult experience. And also they had to acclimate to entirely new life outside the cult, a life they might have never known. Cult leaders usually interfere with the couple's ability to form an intimate relationship and to parent their own children. Parents are induced to feel that time with children is expendable or selfish, that they must keep focus on the grander mission of the cult. Therefore, parents may be separated from their children and spend long periods of time in cult activities. Children might be placed in dormitories or sent away to cult-related boarding schools. Often members who are in charge of those schools have no training in child education and no understanding of the emotional needs of children. Parents often are made to feel selfish if they acknowledge special feelings or desire to have time with their children. In one cult, members were told that parents always have murderous feelings towards their children, and therefore children must be raised by members who are not related to them. In another cult, members were told that parents pollute their young so that all parenting decisions must be left to the cult. These suggestions are an effective way to separate the members from their own children, as well as from their parents who are in the outside world. The children of cult members often are not allowed to behave like children. Upon leaving the cult, parents usually begin to allow themselves to empathize and respond to their children. However, former cultists often experiencing difficulty taking a parental role after they leave the cult. Sometimes this difficulty is related to the fact that they have been treated as children and acted as siblings to the children, because the cult leader was the parent to all of them. Parents also may have difficulty assuming authority as a result of their guilt about having neglected or abused their children while in the cult. This guilt can lead to their having difficulty setting limits with their children after the cult. Other parents continue to hold on to the punitive or sexually stimulating practices they learned in the group. Spouses can come to have different child-rearing practices from each other, and this can cause conflict after they've left the cult. The child who is born or raised in a cult does not have the previous personality or a cohesively formed personality in which the new cultic personality is imposed. Aside from inherent temperament, basic character becomes impacted and shaped by the cult experience. The cult personality is not superimposed, but becomes an aspect of the original personality. When those who've been raised in cults leave that world, they have to enter an entirely new socio-economic environment, a wider world with new expectations and rules. Although younger children, particularly those who exit with parents, typically show some degree of resilience and an ability to adapt to the outer world, former cult members who are young adults, especially young adults on their own, usually have tremendous difficulty with adjustment. Entrance into the world outside the cult is complicated by the fact that their cultic upbringing has left them deprived of many coping skills to adapt to that task. However, we have been impressed with the resilience and strength that these individuals have shown. Working with former cultists has been one of the most satisfying aspects of my life. One of the main reasons for this is that behind these cult-induced symptoms and difficulties are decent, idealistic, and usually basically strong individuals. Actually, I believe that the stronger former members are able to face what they've experiencing without having to completely cut off that part of their lives. It is painful to look at this and requires courage and an ability to tolerate a wide range of uncomfortable feelings. I've given you a long list of problems, but the good news is that these are normal reactions to separation from a cult. For the most part, if armed with information about the group processes and support from others in the outside, former cultists do amazingly well. One of the benefits of our support group is to see how different the cult member who has been out for 2 years is from the cult member who came out 3 weeks ago. It is important to remember that in leaving a cult, the former cult member is beginning the process of discovering his or her true self and beginning the process of living up to his or her true potential. Thank you.
As Lorna mentioned, we've worked with hundreds of former cultists in the past 30 years. And we've come to appreciate all of them, respect most of them, and regard some of them as dear friends. We also recognize that their cult involvement has impacted more people than just the ones that we've worked with. Every former cultist comes from a family, and their involvement in the cult has impacted their family as well. In work with former cultists, as in work with anyone, it's important to know where the person comes from, to see them in the context of their family of origin, which was their first introduction to socialization and to other people. A hermit in the desert responds to his experiences based, to some extent, on his early childhood experiences. I'm going to speak about a family's reaction to a cult member while that individual is in the cult and after he or she has left the cult. I'll describe those reactions and discuss suggestions that I make to the family to help them to cope with these periods. When a family member joins a cult, some members of that family react with panic. They may see the sudden, unacceptable changes in the family members, and they don't know how to deal with them. We all have a script for dealing with more typical problem behaviors. When adolescents test the limits, although it's difficult for us to deal with it, as parents, we know that others have been through this. We have a sense from the media, we have a sense from readings we've done, we have a sense from our friends whom we talk about as to, in general, how to respond with that. Even families that have to deal with more debilitating problems, such as serious illness or alcohol or drug abuse, tend to have more of a script, tend to have more of a sense of how they can respond than those who have to deal with cultists. When people join a cult, they may act as if they were in a science fiction movie. They are themselves, but they're very different from themselves. As a matter of fact, it's the parents, the families, that first can tell that there's a difference in the individual who is in the cult. Professionals, our tools are not sharp enough, not fine enough. We don't see the nuances that the family would see first. And when they don't have a script, the families might react with panic. The intervention of the professional then, or the family friend, or anyone that's helping them, is to clarify what the problem is. The fact that a group has been called a cult, as Lorna mentioned, by the media or by anyone else, does not mean that there's necessarily a problem here. There's many different levels of cultic involvement. Labeling the group is not helpful. What is helpful is clarification of what the behavioral changes are the family is seeing that alarm them. Most people who are involved in most cults are not in immediate danger. Exceptions might be those cults in which people are made to go underground, where the family cannot have contact with them, or where the cult member is induced to throw away medication that they need, or if it's a suicidal cult. In cases like that, the family does have to mobilize and intervene very quickly. But in most cases, it's helpful to help the family to take a step back, take a breath, look at what's going on, look at your resources, and decide how you're going to intervene in this particular case. Friends and professionals can be helpful in clarifying these points to the families. Sometimes it's helpful to look at who should speak to the individual cult member. It's not always the parents. Often it's not the parents. Sometimes it's a family friend. Sometimes it's a peer. Sometimes it's a clergy person that the family knows. Sometimes it's a teacher. It's helpful for the family to look at who would tend to have more influence, who wouldn't get up the cult member's defenses so quickly. I tell families who call me in a panic that we will meet for a few hours, that we'll talk about the history of the cult member, that we'll talk about the group that they're in, we'll talk about the changes that the family has seen, and we will work out a strategy together as to how the family is going to intervene. That usually calms them down to the point where they're able to take a breath and to feel that something can be done here. I want them to leave my office with a sense of that there's a path that they're going to follow in trying to help their family member. I have no magic pill. I can't say to them, we're going to get this person out. But I can say to them, we can have a purposeful way of intervening. And I should mention that intervention does not always mean hiring a professional, an exit counselor or someone else to intervene. Sometimes it can be, an intervention can be done by the family. Sometimes an intervention is just to wait and to see what develops and to keep abreast of the situation. Some family members are too focused on their own issues. They're the opposite of those that panic. They're not able to decide that there's a problem here or that there's an issue that needs to be dealt with. This is often the case with younger siblings who are used to seeing their older siblings as someone that they look up to and that are going through their own developmental stages earlier. And it's difficult for the younger sibling to recognize that the older one needs some help. And they might over-identify with the older sibling. Sometimes siblings are too hurt by the cult member's perceived rejection of them, and they deal with that hurt by becoming angry and say, I want nothing to do with him or her. It's helpful for the siblings then to be able to voice those concerns and for the parents to acknowledge them and to accept them. That's an acceptable response to what you're experiencing. However, we as parents cannot afford to be angry and cannot afford to withdraw. We have to do something to intervene. We hope that you'll help. If you can't, we hope that you'll understand. A more difficult situation, of course, is when there's a rift in the family, such as a divorce, and one parent wants to intervene, and the other feels that that would be an overreaction, or that there's nothing wrong, and this parent supports the cult's member's decision and might even identify with the cult member. This happens often in divorces where the rift between the parents is played out with the cult member as the symbol of that rift. One parent says, we've got to intervene to help, and the other parent says, no, leave him alone, he's doing what he wants to do. Divorcing parents play out that rivalry and might want to be seen as the good parent. This is a tough call for the friend or the professional. You don't want one parent strategizing an intervention while the other is sabotaging it. I try to help parents in this case, if possible, to get beyond their stance, to find a common ground, to recognize the difference between the stance that they take, this is what is going on, versus their need to be respected, to be heard, to be understood, and to help their child. Some family members respond with agony. They obsess constantly about the cult member. They may ignore their other children, and they may become anhedonic. In these cases, I try to point out that what's usually going on is magical thinking. If I am miserable enough, somehow that will be conveyed to my cult member child or family member whom I love, and somehow they will recognize then through my torment how awful it is that they're in the cult. That's a common, very common and understandable reaction, but it's not a very helpful one. And by naming it, by pointing it out to the individual, it can help them to get beyond that.
What did you call that reaction?
Anhedonic, is that
kind of magical thinking?
Magical thinking. You think that if I magically can show the person that I'm unhappy, or that if I enjoy myself, if I can have pleasure, that somehow that's going to take away from the fact that I'm grieving my child being in a cult. And that, again, is not helpful. Parents have to go on with their lives, even as they're trying to strategize to get the cult member out. Very often, parents will neglect the siblings, the other children who are not in the cult, and will focus only on their grief about the cult member. And we have to help them to recognize how unhelpful that is also, that they've got to give attention and priority to their children who are not in the cult. Some families need to be toned down. Their goal is to rush in and enlighten the cult member right away with the information that to them is so obvious. This is such an obvious destructive group. Let me sit you down and tell you about that. And it's as foolish, usually, in most cases, as foolish and fatuous to try to tell a person this is your experience as it would be for a movie star to say, I have studied the history of psychiatry and I know more about psychiatry than the psychiatrists do. Once the families have gotten over the initial stage, they need to be helped to develop a strategy of intervention. Sometimes that strategy involves hiring an expert in the field of mind control to help the cult member clarify the issues. And sometimes that intervention is to do nothing or to wait. For example, as I said, if families are divided over whether the cult member will wake up on their own and come out or need to have an intervention. If I find the family members divided, some saying, wait, he's a smart kid, or she's so smart, and she'll come out of it on her own, she'll recognize it, and others saying, no, we've got to do something quickly, I try to help them to come up with a time period. I say, I have to, and you have to, we have to be respectful of all the opinions in the family. And we have to say, okay, how long do you think it'll take before the young person recognizes that they're in a destructive group? And let's come up with a time, 3 months from now, 6 months from now. If on October 12th, the person still hasn't recognized they're in a cult, then can you come back and see me, and let's see if we have to change our strategy. If we can, again, get the family away from the stance that they take, and instead get them working on the problem solving, then we can enlist them all in the attempt to make a good, valid, helpful intervention. Very often, I get families that come in, and one of them, it's usually the father, comes in like this. The mother is panicked and says, what are we going to do? And the father is rolling his eyes as if she's overreacting. And when I listen to the father and I validate the father and I say, I understand your point of view, it can help the father to relax and to calm down. Now, just between us, I'll tell you that I am hoping that I can help the father to mobilize to get the person out. But it's not helpful for me to impose my feelings on the family at that time. In most cases, it's more helpful to have a united family to intervene than to have a divided family and to move too quickly. Certainly time is an important element in terms of intervention, but I believe that an even more important element is for the family to be of one mind in terms of trying the intervention. First, because the intervention is more likely to succeed, and second, because if the intervention does not succeed, we've still got a family. We've still got a family that needs to be together, and what you don't want to see is an I told you so attitude. Instead, the family needs to be united in terms of saying, we're going to attempt this. And what I try to help the family to see is that they've succeeded if they've given the former cultist, the cult member, another perspective. That the goal in intervention, although we'd like to see the family, the individual come out, the goal is to help the individual to see another point of view. And that they've succeeded if they've done that, so that the family can feel that they've made some progress. At this stage, I may talk about the factors that lead to a successful intervention. I look at things such as the pre-cult mental health of the individual involved, the cult member's relationship with the family, the pre-cult goals and ambitions and coping skills. The greater the coping skills, the greater the chance of their coming out. Is the cult membership ego-syntonic or ego-dystonic? In other words, is joining the cult another of a series of deviant groups that the person has gotten involved in, and this is kind of more of the same of their personality, in which case there's less likelihood of their leaving? Or is it ego-dystonic? In other words, somebody that had the usual kinds of problems that most kids have, but was learned to cope with them and is moving on with their life. Then all of a sudden they quit school, they had a pretty good relationship with the family, stopped having a relationship with the family, stopped looking after their siblings and the like, and there's a complete change in them. The more deviant the change, the greater the likelihood that they're going to come out, even though that seems to be contradictory. I asked the family, how has this individual coped with losses in the past? If there's been a grandparent that's died, or a friend that's been lost, or a love that's been lost, or a pet. How have they coped with losses? Because the way that they've coped with loss in the past will give us a clue as to how they're going to cope with the loss of the cult, the loss of their idealism perhaps, when they've come out of the cult. Understand that exit counseling and intervention can only put an individual back at square one. There is no way that an exit counselor can stop someone from going back to a cult. All they can do is to help them to see different factors about the cult so that the individual can make their own decision. Now, most people, when they've seen those factors, will make the decision for freedom. Will choose freedom over slavery in the cult. But there's no way that they're going back to the cult can be prevented. So I looked for the degree of pathology before they got involved in the cult to help to predict whether that exit counseling is going to be likely to lead them to make the choice of freedom or not. I usually advise families to adopt a stance of disapproval but not rejection when somebody joins a cult. It is not helpful for the family and for most families, them to sit the individual down and to yell, "You're in a cult! This is a destructive group! What's the matter with you? Can't you see it? It's so obvious." I understand that impulse, but it's usually not helpful. I have to say, in some families it can be. It depends on the individual. It depends on the relationship with the family. But in most cases, it's not. I tell them early on that they should tell the cultists, although they may not just approve of what they're doing or the group that they're involved with, the only thing that would be intolerable is if they cut off the lines of communication. The only thing that's intolerable is if we stop talking. We can disagree, but we must continue our dialogue. And usually, in the early stages, the cult member says, "Well, of course I'm not going to stop talking with you. Of course that's not going to happen." And I advise the family to say, "Okay, I'm just making sure." Because sometime down the road, when the cult perceives the family as being negative, they may put pressure on the individual to stop talking to the family. And I want them to have established that contract in the beginning, that they'll continue to talk. I remind the family to remind the cult member that there were other times in the cult member's life that the family disagreed with them, but the family went along with their decision. That if the cult member feels, well, you're trying to control me, or you're just upset because I'm doing something that's different from your belief system, I remind the family to say, well, no, there were other times that you've done things that we didn't like, and we told you we didn't like them, but we let you do that. This is not a case of we're not trying to control your life. This is a special case. This is something that is particularly upsetting to us, and it's important for you to hear the reasons why. Your goal in the dialogue is not to score debating points, but to bring to the conscious mind the pre-conscious doubts that the cult member has. All cult members are ambivalent. All cult members have doubts. They learn to squelch those doubts. They're given techniques to squelch those doubts. The cult member teaches them, the cult leader teaches them to squelch the doubt. The cult member labels those doubts as unhealthy or satanic or bourgeois, whatever it is that the cult's label is. They'll label those doubts. What you want to do is to recognize that they have the doubts and bring them to the cult member's conscious mind. So therefore, I tell the cult family to be curious and confused. I don't understand. You tell me that you're in a group that's going to help people, but I see you spending your time all day selling flowers. I don't understand how that's helping people. Wouldn't it be more helpful to work in a soup kitchen and feed hungry people? I don't understand. How many people have you visited in hospitals if you're trying to heal people? I don't understand. I'm confused. Theologians have struggled for centuries to determine just what God expects of each of us. And now along comes stunky old you, and you have the answer to these great theological questions. Anyone know stunky in Spanish?
I don't even know who he is in English.
We'll talk later about that. Tell me, do you ever have doubts? Is there a chance that you're wrong? You see, if your stance is, I'm confused, I don't understand, please help me please explain this to me, you're less likely to evoke defense on the part of the cult member. They're less likely, if you're trying to understand them, they'll be more likely to try to explain to you than if you say, well, this is what's really going on, then they're likely to be defensive. Now, the answer that they give to these questions, their attempt to help your confusion, is almost irrelevant. What's important is that you've brought to their conscious mind the doubts that they are unconsciously having. And whatever answer they give, I'm less concerned with that. You've voiced the doubts that they don't permit themselves to look at. And it's a step in that direction towards helping them to reconsider their position. I sometimes say I'm confused about this because you tell me that this is not a cult, and I believe you. I know that you're an intelligent person. But when I say to you, would you like to speak to somebody who has some information that you don't have about this group, you tell me that you won't speak to anyone that has a different point of view. And that's what cults do. Please help me to understand, because I know this is not a cult, but you're acting as if it were a cult. How can we reconcile that? Sometimes I ask them to say to the cult member, what do you think you'd be doing if you weren't involved in this group right now? Where do you think you'd be? Because you see, people can't think of leaving a group until they can picture themselves out of the group. Okay, we're going to skip some of this. After the cult member has come out, I help the families to remember that this great moment of triumph for this family, this time when the family members mobilized, got the person out, possibly risked future relationships with the cult member, and triumphed in getting them out. This wonderful period may not be quite so wonderful for the former cultist, because it may be seen as a humiliating experience for them. Here, the most correct decision that they ever made in their life turns out to be a tragic error. And we have to be sensitive to that and to recognize that, so that when most families can resist the urge to say, "I told you so." Most families can. But many families find it difficult to resist the urge to hear the ex-cult member say, "Thank you, you were so right and I was so wrong." That might take a while for that to come out, and I try to help the family to empathize with the cult member who is still, as Lorna said, fearful of being controlled, who's afraid that they can't trust their instincts again. I try to help the family to work with the ex-cultist to say, "Look, your instincts were right 99% of the cases. Usually you're right. They were wrong in this very important case, but that doesn't mean that you can't trust yourself again." And after a period of time, people usually do begin to trust themselves again. On the subject of resisting urges, it's important to resist the urge to tell the former cultist what his or her experiences were like. Don't say, "This is what happened to you when you were in the cult. You were under mind control. You were brainwashed." Instead, to speak about what that period was like for you. "This is what I heard. This is how we mobilized. This is what we were fearful of." And to say to them, "What was it like for you when you were going through this?" Again, the issue is to open up a dialogue, not to be right, not to be confirmed that you were right. Don't be afraid to hear about the good things that happened in the cult, because certainly there were good things, and it's important for a former cultist to recognize that there were some things they gained, and some things they learned, and some things that felt good. And that's why they stayed in the cult. That's part of why they stayed in the cult. Recognize that many ex-cult members, as Lorna said, are exquisitely sensitive to being controlled. And I'd like to just say one word about families that leave cults as a family. Those that were in the cult and then came to recognize there's something wrong here and left as a families. In some ways, this is more difficult because there is not a family member who's an anchor in the outside world who can help to kind of re-socialize the family and guide them through. But in other ways, they're more fortunate because the family all knows what they're going through together, and they can support each other in their attempt to reintegrate or to integrate into the broader society. For some families that are basically healthy, they'll be able to support each other and talk about the changes, the fact that it was okay when we were in the group to check with everyone before we did anything, to check with someone before we did anything. But now that it's out of the group, we have to do this on our own and to talk about those things. And for other families, professional intervention might be helpful. Well, I have gone on and on. I have used the word anhedonic. I have used the word stunky. I'm glad to speak about either of those. Lorna and I will be happy to answer any questions or entertain any thoughts that any of you have. Yes, sir.
Right, yes, sir. My name is Takushi Yamaguchi. I come from Japan. There's one question that I wanted to ask. Sorry if it may be my English vocabulary, but it's the word use ego-tonic and ego-dystonic.
I'm sorry. I'm sorry that I used that term and did not explain it well. Something that's systonic means that it fits, syntonic means that it fits in with the individual's view of the world. It's ego-syntonic for Lorna to correct me, and it's ego-syntonic for me to thank her. If ego-dystonic means that the person's doing something that's unusual for them. It would be unusual for Lorna to get angry at me because I used a psychoanalytic word incorrectly. It would be ego-dystonic. She doesn't usually get angry at me. So this would be out of character for her. When people join cults that are more like them, their behavior is ego-syntonic. Their behavior is, they tend, if they're people that tended to be very subservient and to listen to what other people said and to not speak up, and they joined a cult that reinforced that wanted that behavior, then that behavior is ego-syntonic. It's going along with their personality. But a person who had been very assertive, who knew his or her own mind and then adopted that meek personality, that would be ego-dystonic behavior, and it's a much greater likelihood that they'll leave the cult if that's the behavior that they adopt. I hope that clarifies.
Thank you
Yes, sir.
very much.
Oh, yes, sir.
My name is M.S.W. This might be a very personal question or individual question for me. I have two boys. My oldest son was born in the cult and got out of it when he was about 9 or 10. And I'm going to cry now. And I had great difficulties putting limits on him, like you said, because I was raised by the cult leader to be his sibling, more or less. And that is my major problem.
It's hard because exactly that. This happens to so many families. It's such a common problem. Parents come out and they were treated as siblings to their own children, and therefore they can't be parental. They associate the parental role simply with the cult leader, right?
And also, do you lose the respect for my son? He doesn't respect me as a mother.
That's right, because your role was always diminished and put down. You were not important in the cult. And for him to survive in that environment without you, or periodically, he adapted the cult leader's attitude, right? Which made you less important.
How did I change that?
I think that it's just a matter of time and degree over time. I think that you really, I think for you the struggle might also be that when you assert yourself with your child, you're also acting in a way like a cult leader. He was the director, she was the director of the group. And people, when they come out, a lot of people really hate feeling that they're acting in any way like the cult leader did. So to take any kind of authority is very abhorrent or hateful to them. And I think that if you're consciously struggling with this and really coming to believe that setting limits, taking control in situations where he really does not know best is going to help him, is going to be useful for him in the long run, that will help you, but it will take time. Is there another parent there sharing this with you, or are you doing
No,
this
the
on
father was the cult leader.
So now you're talking about a situation that's even more difficult because there's a biological tie. And because the father, does he still have contact with the father or not?
He's been having some secret contacts with him that I've heard about in roundabout ways. But because of the court case and the law now helped me to correct that, I think that would not be so so much contact, and also my son is familiar with it and accepting that. He won't have any contact with his father.
But one of the difficulties was, as badly as children are treated in cults, if you are a child of a cult leader, I don't know if this is true in your group, you're like a prince in certain ways. If the cult leader is the king of the cult, you are the prince or the princess, being their child.
He acts like that.
So he was raised early on. I don't know if any of you saw the movie The Little Emperor. You know, that's a The Last Emperor. And you're treated like a prince, like royalty. So he's coming to terms with the fact that his mother has robbed him of his royalty stature. When he goes to, if he's in the outer world going to school, he's just one of the group. He's one of the other kids. And that's quite a loss to him. So he's probably struggling with those feelings as well, that you've robbed him, even though you're giving him the possibility of a much greater life in the future. You're robbing him of that important stature, and his relationship with his father gives him that. I think that what might be heated up for him is if he did have some negative experiences. What is the flip side of that? What was the painful part? What was in the group? Because he might very much be remembering his positive. The positive.
So if you can acknowledge that there were some good things he liked there, but there's good things that are happening to him now on the outside, such as freedom in the future and things that he'll come to recognize and appreciate later on, it might take some of the sting away from his loss of stature. So Lorna's saying is there's bringing it to the table, saying, yes, this is the way you were treated in the group, but now here it's really better for you in the long run to be treated in this other way, and feeling comfortable yourself in doing that and recognizing that setting those limits is exactly what you need to do. That's the parent's role, and that will be so much healthier for him.
Let me also say that part of his character, because of these early experiences, might continue to be somewhat arrogant, and he's going to struggle with this. But again, if he can come to see how that arrogance can put other children off, and how he can lose by being this way. And maybe you're not the one to help him with everything. Maybe there's someone else that can, talk with him or work with him about these issues that he's...
And that would be all right?
Excuse me?
And that would be all right? Someone else does it? Because Stephen hasn't told me through another person that I should be the one talking to him if I haven't misunderstood.
Both. But I think
perhaps
that...
a therapist, a child therapist.
Yeah.
But they don't exist in Norway with the knowledge sectors.
Yeah. But there are no child therapists in Norway?
Yeah, of course, but they don't have the knowledge about sector.
Well, you could if you find a good child therapist who is open-minded, and you can educate them. I mean, they can learn about the dynamics of cults. But a good therapist who's used to working with children would also be able to, really talk with and particularly maybe a male therapist.
I'm educating, so maybe.
Excuse me?
My own therapist, I'm educating, so.
Oh, good.
I'm trained I'm training as a therapist, and I've just trained with a woman who works as a therapist in Norway.
Really? Oh,
And I'm an ex-cult member and a therapist. And she's heard me for the last 4 years going on about cults. So as have they all. So maybe I could give you a link.
The chances are that when he was told to do things in the cult, it was without explanation. You just have to do what I tell you to do. So if you can explain in terms that he can understand why you think it would be harmful for him to do what it is you're trying to limit him from, over time, I think that will have an impact on him. And eventually, you'll be teaching him how to make his own choices in a much more thoughtful way. How old is he now?
16.
Oh, yeah. At that age, you can give rational explanations. Now, there's also rebelliousness that is present, but at least give them complete and total information and hope that they can make informed choices.
The problem is that we haven't been able to communicate because he's totally disrespectful. And he triggers he's following me, and I trigger the past life in him.
Yeah.
So we haven't been able to talk. We start shouting,
And that's where I agree with Lorna that a therapist communicating the same concerns that you are trying to communicate but are unable to successfully, the therapist might really be able to get through.
It's just taken me 5 years to make him agree to come to therapy.
Wow.
Well, he's agreed. That's a good step.
Yet. We'll get there.
You know, Ron made a good point that also his age and living with his mother alone, that it's a tough situation. And when you're 16 and you're living alone with your mother, to get along with your mother. it's naturally, I mean, even if you haven't been in a cult, it can be a difficult situation.
2 questions. Must an ex-counselor be able to counsel all the loved ones, no matter what the cult? I mean, there's such a profusion of cults and sects. Is it important just to specialize in certain cults? And question number 2, what is the hope of getting a cultist out of a cult who is disconnected to the parents? Disconnected is obviously the connected as well.
I think a good therapist should be able to change his or her approaches regardless of the almost regardless of the circumstances. So although some therapists might specialize in working with a particular group type of cult, and others might have know nothing about cults, be willing to learn. I would, if I had a choice between a mediocre therapist who specialized in working with former cultists versus a very good therapist who had no knowledge of cults, there's no question I would take the more experienced therapist. Because part of, even though this is an area of specialization, even though there are unique problems that former cult members experience, there are more commonalities than differences. And a good therapist who is willing to learn, from the client, who's willing to learn from literature, should be able to modify themselves to work with the former cultists. I've heard awful stories of people who go to therapists who tell them, well, you must have been sick to join the cult in the first place, or who say, well, let's talk about this so-called cult of yours. That's not a good therapist. No. But I've heard, and we've all heard those stories, but I've also heard wonderful stories of therapists who had no knowledge of cults, but who picked it up right away and understood what was going on, what the dynamics were. In terms of intervening with somebody with whom you have no contact, it's very difficult. I don't have a good response to that, except to say that there are cases that I know of that I've worked with where somebody reached a certain point in their life and decided they wanted to reconnect with their families. Sometimes it happens in decades when they turn 30 or 40. Sometimes it happens when they have children themselves. Sometimes it happens when their children are the age they were when they joined the cult. The only thing I can say is to remember that you did have all the years of nurturing and of family times, and the cult cannot erase that. They can reinterpret it. They can try to make it something that it wasn't, but they can't completely erase it. And just again, that's why I always emphasize to the families that it's important for them to maintain a dialogue if they can.
William?
Yes.
Going back to the piece about, finding the proper therapist which is what families very often want. They want to find the guru who's going to de-guru their own kid or something like that. And I agree with you in the sense that a good therapist is always the best person for the job because he has the sensitivity. At the same time, from the family's perspective, they're the ones who are usually projecting. And they're the ones who are usually looking for someone who knows more about this sect because otherwise you wouldn't understand what we're going through. And I'm saying this because I'm coming from a very Catholic perspective, and we very often think that we are different from all the other religions, besides being the best. Of course, we're not only the best, but we're different. So that how on earth would you, outsider, understand the particular intricacies of our religious, and I'm saying this as an ex-priest, so please be patient. I think I have a right to say it and to kind of ridicule it to a certain degree. But this is something that
But it's not unique to Catholics.
That's what I think we need to. But I say so. So when people have been approached by some people who are, you might say, have their kids in what I would consider a Catholic cult-like organization, they're very kind of fundamentalistic about like if you're not a priest, you're not going to be able to help us. If you're not a rabbi, I don't know, whatever thing is, So I think it's a common thing. And how do we educate the families, or how are you able to sell it to them better?
I can answer that. I moved to Massachusetts from New York State, went into private practice outside of Boston, and largely through a couple of Irish Catholic clients who decided I was helpful. Suddenly I had a private practice where about half of my clients were Irish Catholic. I grew up Jewish in upstate New York. I got educated. It works. The clients will tell you what happened, and if you just say, okay, I think over time you said it, you can make up for not knowing anything about it until you get the first client with that.
But they have to overcome their own prejudice.
Right.
In order to take advantage of your ability. Right?
Sometimes they can't.
Yeah.
And that becomes self-selective. I mean, we see this in our support group. Bill and I are Jewish, and some people would not come to our support group from certain kinds of groups because it's too much. They feel that it would be too much of a big step to come to a group.
Just a word of warning too, the parents can do everything they possibly can to pick what they think is the best possible counselor, psychologist, psychiatrist, exit counselor, and when the cult person becomes involved, it is absolutely the wrong choice.
Sure.
So sometimes you need to be able to switch gears and do it quickly.
There's factors that...
It's just sometimes the personalities don't blend.
I just also want to say, Lorna talked about the ex-cultist who came to her and said, I don't know if you're spiritual enough to be able to help me. And I often will get calls from parents, families that say, do you know anything about XYZ group? And I say, no, I'm sorry, I don't. And they say, oh, well, then you can't help me. And I say to them, the truth is that I know pretty much what happened to your son or daughter, even though there were different words in this group, even though the experiences of ex-cultists and of cult members is more similar to other cult members than different.
Yeah, I get you.
In our group, we have people that come out of political cults, economic cults, pseudotherapy cults, religious cults, science fiction cults, and they come together and they all have had the same experience, but there was a different word that was used. They have the same fantasies, they have the same pressures, they have the same, everything was the same, but there was a different word. And people often will say, I had no realization that I could relate to somebody who was in a religious group or in a political cult, but your experience was exactly the same. So, I mean, and I don't know how to overcome that initial resistance except to say, this is the truth, this is the way it is, and that's it. Patrick?
Yeah, I'd like to say two things as a person who wasn't in a cult. One of the things is that I think a therapist who is really good, like you had said before, who maybe hasn't been exposed to this kind of training, can still be very instrumental to the person who was in a cult if they're really keying in on the things. And for me, when I was still in the group, I was fortunate to find a therapist who just sort of validated my doubts about what was going on. Not aggressively, not saying, oh yeah, that's absolutely, no, he was very calm, very collected, and that sort of helped me come to a realization where I could walk away from it. The other thing I was going to say is about the religious thing. I know that personal experience, it does affect you. If you come from a religious background, you sort of want, and it doesn't necessarily make sense, but you sort of feel like, well, I want the person to be Catholic, or I want them to understand, I want them to have a focus on my group.
Of course. Yeah. Sure, that's natural, and it should be put on the table and acknowledged by everyone concerned, and that's human nature. That's not. There's nothing wrong with that. It's something that can be overcome if you find a good person, and we all can struggle with that.
Well, I was going to say, in hindsight, it didn't matter.
Right. Right.
I just want to ask about this recovering the belief in making decisions again for ex-members, because you said something about to the fact that this is a good decision when you leave, it wasn't so good when you made the decision to join, but I'm just wondering about that, because most cult members don't make a decision to join.
Sure.
They're recruited.
Sure,
so that's something
sure.
completely different.
Sure.
How do you address that?
Well, the question was, most, in terms of decision making, most cult members don't make a decision to join a cult. They're recruited, and they get swept up in the cult. So when we try to intervene and help people to recognize that they can still rely on their decision-making capabilities, how can we do that? My answer would be that everyone makes the best decision that they can with the information that they have at the time they make the decision. That the issue is not, did I choose to join a cult or did I not choose to join a cult? But at the time, what happened to me, what pressures were put under me, what made me go along with the recruiter. And if I had the information then that I have now, I might have said, no, I'm not going to go with you. I try to help people to recognize that with the knowledge they have now, they might not have gone along. That there were very powerful forces that were used to sweep them into the cult, that the cult recruiters usually use unfair, deceptive, unethical tactics to get them in, and that that there was nothing wrong with them because, for example, if they were looking for a religious leader and they had found one of the majority of religious leaders who were benign and helpful, they would have been fine. If they were looking for a therapist and found one of the majority of therapists who were good and helpful, then they would have been fine. That they happened to be in the wrong place at the wrong time, but their need at the time to find somebody to be helpful was not a bad need. It wasn't a case of pathology.
Yeah. So just the answer to the responsibility question then is that you just didn't have the knowledge about
Exactly.
psychological needs.
Exactly.
A really great thing for a family is, something that you can say is, we taught you not to take candy from strangers. We taught you about safe sex. We taught you about boys or about girls. We taught you the birds and the bees. And we're sorry that we didn't know that we also needed to teach you about these horrible people. And it gives the parents a sense of humility that maybe the son or daughter needs to hear, to take a little bit of blame off of them for their complete stupidity, in parentheses, of course. And that can really help the family also after the exit to get back on track. It gives everybody a bit of room for humility. And it also can lead to that big thank you.
Maybe you'll never get it.
Let me just say, this session is officially over, but we'll be glad to stay and answer any questions people have. But if people need to leave, we won't be insulted.
No, I just want to say something to you that, you're talking about the horrible people. I think when you enter a sort of sect or a cult, you don't feel like that person or those people are horrible. You feel like they're sort of giving you answers to your questions, as young people. And when your parents confront you with, this is wrong, or you have to parental voice to you, you are very defensive, and you try to sort of be rational about it and be logical about it, and there's no way you can accept you're in a sect. I mean, here are these people telling me you're in a sect, and you feel, no, absolutely not. This is my choice. This is what I want to do. I'm freely choosing. I'm over the age of 18, and I think it's difficult because when you see now back in retrospect, you feel, where am I responsible for joining this sect, Am I responsible? These are questions I want to have answers because I don't know, are my actions in all those years I was in the sect? You understand?
And the thing is that on the outset, the group deceived and exploited you. In other words, you had ideals and a belief system on the outset that it fit maybe an idealistic way of looking at the world or something like that. And there was deception and exploitation behind the way that it looked. And it was a step-by-step process over time. It's like a frog in boiling water that doesn't feel the heat rise over time. It's a very slow, deliberate process.
But when people tell me that, why didn't you leave? I'm just sitting there with.
Well, that's not a really helpful intervention there. That's
How
one of
do
the
you
most-
now? Now they want to know why
Yeah.
didn't you leave? Were you imprisoned? No.
Yeah.
But in some ways you felt yourself to be imprisoned. Again, if you had the knowledge then that you have now, you might have left. And if you had been able to put things in a perspective, now in retrospect you say, well, perhaps I could have left. But at the time, you didn't see that as an option that was open to you. That's what again, each of us makes the best decision that we can with the information that we have at the time we make the decision.
It's also helpful to learn a lot about the processes that these groups use. How they, and in your group, how they changed reality, how they define things in a way, the difference between their doctrine and their actions, how the reward and the punishment system influenced you, all aspects of mind control and how it works, and bring it back to your own group and figure out how in the group that was done to you in a way that kept you there.
So I'm not responsible.
Well, there was your doubts. I would imagine that you had doubts or conflict, but there were things that were done to press those doubts down. You know, you were responsible for being receptive to their message at that point in time.
But any of us could be vulnerable under the right set of circumstances at any time. All of us go through periods of time when we're vulnerable, and all of us have gotten involved in doing something or believing something or listening to somebody and then say, no, I don't want to do that. I mean, is there anyone here that's never bought something on impulse or said something impulsively or fallen in love with someone and then found out that they weren't the person for them?
There's a lady at the back here.
Oh, okay.
There's a lady here at the back that had her hand up for most of the session.
Yeah, that comes from the same cult. And what we talked about, there's one more thing I was going to say about, and what we talked about is that the leader used the systematical thought control system, which I believe is just the universal one, more or less.
Which you believe is what?
That's universal.
Universal.
Yeah. And but that he applied different tactics on each one of us according to your personality. Which makes it in a way, because you said now we have to find out what was done to use that Lorna, and to get the knowledge about it, we can recover faster.
Right. Yeah.
But you have to do that on your own then.
Well, you can do it on your own. You can go to conferences like this one, that will talk about how these things are done. You'll read, you'll talk to people, talk to other people who've come out of cults, and they might, as Bill was saying, it doesn't matter what cult you come from, the processes are very similar. The way that they were defined was different. The words that were used was different. And it sounds like your leader was very astute in picking up sensitivity, in different people, so he would learn how to manipulate it. And Lifton talks about confession in cultic groups and in psychotherapy groups and in so many different groups. There is a confessions process where they get the goods on you, and then the goods are used against you.
There's also something, and you referred to it before, to lead, you have to have, it was necessary for me anyway, there had to be something that I knew I was going to go to that was going to work better. I knew that I didn't like the situation that I was in, and partly because of the suggestions that were being made to me by the group leader, I couldn't figure out something that was better. And it's the same thing. Why didn't Patty Hearst get out of the car? There was a very good reason for her and for people in those situations where until there's something safe that's going to work better for you, you choose the thing that you're not happy with. And that's a valid choice. I mean, it's important to validate that for people who've been in those situations. That was the right choice then, was to stay until you make a better solution for yourself.
But the leader made you think that there wasn't anybody.
That's right. That's right. Even though the threats from the leader, in retrospect, that was absurd. The fate that was predicted for you if you left was never going to happen. But you still couldn't see that for yourself, and that's a good reason to stay.
Because the family's not to blame. I'm not to blame. There's no one to blame then, actually.
Exactly.
Yes, there is.
Right. There's someone.
There is absolutely someone to blame.
I blame the leader very much, because you know what I mean. The family thinks, what did you do wrong? What did I do wrong?
Sure.
I just want to know, when people take advantage of young people, like yourself, why isn't there any network that can, follow this up and punish them? I mean, why are they still out there? Why?
That's why we're here.
Yeah, but we don't help. I mean, he still has, a girl.
Yeah.
They have to do unlawful things.
But he's done that.
He's done unlawful things.
Yeah, I don't have an answer other than the fact that we live in free societies, and we believe in freedom of choice, and it's part of the weighing process that the price we pay for having a free society is that we have people that can exploit others, and if it seems as if the person's doing it of their own free will, they get away with it. I think I wouldn't like to live in a society in which there were no cults, because it would mean that it was such a repressive society that people couldn't deviate, they couldn't be different, and I think it's part of the weighing process of our society. I certainly feel the same way. I would love these people to be prosecuted for what they do, but I'm not sure how to write a law that would stop them from exploiting others, but give other people who want to be different the opportunity to be so.
I understand that, but you're talking here about some cults. I think you have a lot of people living in normal family situations who are mentally abused ordinary ways.
Sure,
And,
sure.
you know, if you have expert witnesses or people who have knowledge about this, they must be able to help
Sure.
and pick up the signal from the kids.
Sure. I understand.
Sometimes, I'm thinking of one group in particular, sometimes when the children are sexually abused, because the language used around, in the atmosphere where they're growing up is so, pseudo-religious or pseudo-Christian, and
Right.
all mixed with love and all of that. When the police interrogates the kids and they say, well, have you been abused? The kids will say, oh no, my daddy loves me.
Yes,
So
good point.
it's really difficult to prove.
I know, but I'm thinking school, family, friends. I mean,
Yeah.
of course, if someone talked to me and say, "Are you happy? This is what you want?" Of course, I would say yes. I would lie. I would tell myself the truth. I would never admit it while I was in there.
That's good. Oh, I'm sorry.
I was just going to share a few things. Phil Albert was a fairly well-known lawyer who was in here, won a big case a few years back. And the reason why he won it wasn't because he was going around and trying to prove that this was a cult, or trying to prove that there was, these egregious sort of, manipulations of the mind. What he did is he went for what's on the law. And the biggest problem, perhaps, is that governments and countries in general have laws that specifically protect children or individuals. And you have to look for those things to pursue, and not try and pursue it under the idea of a cult, not try and pursue it under other ideas. And
Not mind control.
sorry,
No.
you can't, because there's no laws against it. And so that's one of the biggest difficulties that you're going to encounter. I'm looking at a case right now in the U.S. that is very similar, and to be able to prove this is going to be very, very hard. So I think that really the first step is not to try and sort of go at it, just like the professor at the introduction was talking about cults, not saying this is a cult, but you can think of it as sort of a general thematics and not discuss it with the law, because the law is going to think about, okay, what was the specific law that was broken? And this is an important distinction. And maybe this is just a progression. Maybe with enough conferences and other things, it's going to change. I think that's the other thing. Is there's a lot of cults that protect other cults. I came from a cult, and that cult is very, very egregious at protecting other cults. And they come in with a lot of money, with cults that have no power whatsoever, just so that there's no precedence created. So all these things take a part. If that helps you to sort of identify some things.
Yes, sir.
Me and my colleague here are lawyers in Japan. We do litigate against cultic groups. One of the things that we do realize is that we were working on child abuse group. It's a small group called Home Pot. We would be holding a poster session. They were raising children in a cardboard box. They were raising baby in secluded environment inside a cardboard box. But the prosecutor did not bring the case to court because the children there did not admit that they were victimized, and the case just doesn't stand. So the prosecutor just said, you can't bring this case to court, and it's over. And so that is a very big difficulty, because it's very hard, because we live in a society where law says that you have to feel that you're victimized. But the children inside there do not feel the victim as their parents are there. They don't believe that they are in a weird environment. But they, and I don't want to say this, but they do lie, that they have been lying to the authorities.
That's right, because children growing up in cults, what is done to them, the severe punishment, is reinterpreted as a result of Satan in them, or as a result of their bad actions. They are causing the treatment, so they don't feel that they feel they're to blame, so they'll hide it. They'll hide it because they're ashamed of their badness, and that's why they won't tell you about it.
I will be giving out handouts at the poster session lately about the case, so if you're interested,
thank you.
I just wanted to comment on the talk we had about choosing the psychologist. I was in a Catholic group, and within the group, there was a policy of washing the dirty linen at home. So you couldn't seek help on the outside. And there was, the group had contacts with a psychologist, a psychiatrist actually, who was connected to the group. And then I was feeling very, very bad being a member of this group. And so I was sent to this psychologist who decided that if you feel bad when you're on the path of truth, then there's something wrong with you. And so I was given a lot of heavy medication to help me cope with my so-called depression, from which I was not suffering. I was suffering from manipulation.
Right, yes.
And when I left, because I left on my own, just one day I just had enough, and I left. And so when I was looking for counseling, I also had this induced idea that us Catholics are so special, no one will understand us except for the Catholics. And so I was looking for a Catholic psychologist, and I'm from Sweden, and there are not very many Catholics in Sweden. And I only found one, actually. And it turned out that this psychologist was a very active sort of pseudo-political force in the Catholic Church of Sweden. I was very, very liberal. As I came from a very traditionalist group, she was just sort of wanting to hear things, bad, negative things, about traditionalist groups of the Catholic Church. And so I didn't receive any counseling. And I left 7 years ago. And now I have a psychologist who knows nothing about the Catholic Church, but from whom I get so much better counseling.
Because she was willing to listen. She was open to listening. And the irony is that for a lot of you, your openness was what brought you into the cult. You were open to considering different options.
But it also means that you're already healing, because if you weren't healed, you would still be looking for that Catholic therapist.
One more question, then we're
No, I don't have questions. I have two comments. I want to say that in spring this year, the activity of Jehovah's Witnesses was forbidden in Moscow, but I meet Jehovah's Witnesses group members every day when I go to work. So it's not the method. This is not a solution. And besides, I think, and what the organization where I work, we try to do is education, is information, and we have the booklets that we send out, and we have the radio programs when we speak about the religion things and about cultic problems. So I think the solution would be rather the information to prevent people getting in cultic groups.
Thank you.
I just have a last comment about choosing psychologists, because I think it's also the case that you cannot rescue people from themselves. You have to want to take information in. Because when I was in this group and on the heavy medication, I was even worse. So I went to the hospital because I was in a terrible state. And at the hospital, I didn't tell them that I was suffering from mind control, from manipulation. That's why I'm feeling so bad.
Sure.
I had to tell them that I don't understand what's wrong with me, because everything is perfect. help someone who doesn't realize what kind of problems they have.